Hello, this is Tambar from Chicago Arthritis. Today I want to talk about something interesting that I saw in the office today that is indicative of a problem in regenerative medicine that I think we can learn from. So a patient who I've known for several years, I've treated her for some osteoarthritis, rheumatoid arthritis in the past, and she gave us a call today in the clinic because she was having a lot more left knee pain and swelling. Getting a further story, it turns out that she had recently been treated by another physician for her left knee pain, and the treatment that she received has some issues with it, both micro and macro issues. So what she received was a amniotic fluid product as well as a steroid injection at the same time. So this is a problem for a couple of reasons. On a micro level, this is a woman who already has a baseline immune system based on her rheumatoid arthritis that makes her more prone to inflammation issues. Injecting a synthetic product such as amniotic fluid is not ideal, especially if you have an option of using autologous biologic injections, meaning using her own cells, either blood, platelets, or bone marrow aspirate concentrate stem cells. Moreover, in her case, she was told that she'd received a stem cell injection, and the data out there on this particular product shows that there are no live stem cells in this product. So she was, either misled or confused about the treatment that she had gotten and received a treatment that in her particular case really didn't make the ideal sense. Number two, on a macro level, does it make sense for someone to be getting a potentially regenerative treatment like amniotic fluid or any other regenerative treatment and a steroid injection at the same time? It doesn't. For starters, the goals of each treatment are completely in opposite directions in terms of how they work. Number two, the steroid injection will actually minimize or nullify the regenerative treatment that she received as well. So on a macro level, the understanding of what is trying to be achieved on a medical level is completely off as well. So you've got micro and macro problems here, and really for this field to grow properly, it is incredibly important for the physicians who are doing this to really have a focus and specialization and an understanding of what they're trying to achieve, and what's the macro understanding of why these treatments work and how to properly use them, and then a micro understanding of how to pick and choose the right patients, how to tailor treatment correctly for the right patient, and how to get a better outcome than what this particular patient has received. Anyway, on a professional level, I think we have a lot of room to improve, and this is a great example of that. But the exciting part is that we do have potential to really improve a lot. Thank you for your time. Leave your comments, and hope you have a good day.